Hi, good day to everyone. Welcome to our first episode of Vitalyse, a new series of Pantai Hospital Penang Health and Wellness Program. Today, it's our pleasure to have Mr. Chua Hwa Sen, an orthopedic surgeon specializing in arthroplasty, to join us on our first episode with the topic of post-COVID-19 pandemic, resumption of elective orthopedic surgeries. Mr. Dr. Chua Hwa Sen has done his MBBS and MS Ortho in University of Malaysia, fellowship in adult hip and knee reconstructions and arthroplasty in Australia, fellowship in pelvis and acetabular trauma and hip reconstruction in Switzerland. Welcome, Mr. Chua. Thank you for gracing today's episode and being our guest of honor.
Hi, good day everyone.
A delay in your surgery may be disappointing. COVID-19 pandemic has created an unexpected and unprecedented national and international emergency. As the crisis is slowly under control, orthopedic elective surgeries, which was deemed unnecessary in the peak of the pandemic, are not possible with proper measures to adapt into this new normal. Mr. Chua, can you explain what is elective orthopedic surgery?
Elective orthopedic surgery is surgery that is scheduled in advance because it does not involve a medical emergency. Cases such as infection-related or fractures are actually emergency or semi-emergency and needed to be performed without delay. These cases were ongoing even though in the peak of this pandemic, as they cannot be delayed. Elective surgeries are like total joint replacement such as TKR or PHR, are elective surgeries as these surgeries can be delayed. I've delayed all my joint replacement during this period.
Mr. Chua, why are elective surgeries being postponed or delayed during this COVID-19 pandemic?
This pandemic has been unexpected and unprecedented. During the peak of the pandemic, it was very important that our country in general and healthcare in specific concentrate and spend all our energy and resources in combating this situation. Therefore, elective surgeries are deemed as non-essential at that junction.
Mr. Chua, you are a joint surgeon. Can you then say that the patient that need total joint replacements, since they are elective surgeries, will be delayed indefinitely?
No, I don't think so. Many of my patients that require their joints replaced are actually suffering from pain as well as loss in functionality and ambulation. These so-called elective surgeries are very important to help them to improve their quality of life.
If so, when do you think they can resume their planning in getting these surgeries done?
There are a few factors to consider here. First, it is about the control of the pandemic. We know this pandemic is not going to be able to fully under control until a vaccine is made available. However, after months of combating this, we are actually starting to understand this virus. Our country, and in particularly Penang, have managed to control the number of infection to a very respectable number. We Penang has attained green zone. With the local community incidents under control, the consideration of starting the electives can now be made. Secondly, the hospital must be ready. The doctors and the staff must be ready, and certain adjustments need to be in place to adapt to this new normal. And at Pantai Hospital Penang, we have taken all the necessary consideration to be ready for this.
You said hospital to be ready. What has Pantai Hospital Penang done so far?
Our hospital has taken a few measures to be ready. Firstly, we have made a pre-admission RT-PCR testing compulsory for all elective surgeries, and these tests are all available in-house. This is to ensure that we protect all our patients as well as the staff during the elective surgeries. And secondly, in terms of the facilities, we have segregated all our operating theatres and wards to handle these pre-admission tested negative patients away from those emergency patients that are still awaiting results. Thirdly, hospital has adequate supply of PPE, as well as the staff are now all trained for the correct technique of donning this PPE.
So, say a patient is interested in getting a total knee replacement in your hospital. What should he or she do?
First of all, make an appointment to see me. I will assess the patient's symptoms and signs as well as the suitability for undergoing the surgery. A preoperative assessment, including blood tests, an ECG to check the heart, chest X-ray to check the lung, as well as a series of knee X-rays for planning purposes. The surgery, implant type, and possibility of computer-assisted total knee replacement can then be discussed and decided prior to the admission. Once the decision is made, a date for that surgery can then be fixed and a pre-admission COVID-19 swab can then be taken no longer than 3 days prior to the surgery date. Having said that, there's also a telechat facilities that's available for the patient to engage to first check online with me regarding some information about the surgery before coming to see me for the first pre-operative appointment.
I realize you mentioned computer-assisted total knee replacement. Can you elaborate on that, and what are the advantages pertaining to this post-pandemic period?
Computer-assisted total knee replacement is a procedure that utilizes sophisticated computer imaging as well as calculation pre as well as intra-operative to assure a highest level of precision in performing a total knee replacement. It is very much like our car navigation that point towards the perfect direction and alignment for our implant placement. This will help in achieving a better clinical outcome and avoid unnecessary revision due to error, especially in this period, where we want to minimize the hospital stay as well as contact.
So, minimizing hospital stay is very essential. What is a typical length of stay in total knee replacements or total hip replacement?
Typically, the stay about 3 days and 2 nights. Admission will be on the day of the surgery, since all my pre-operative care and assessment has been done as outpatient during the first appointment. Post-operative day 1, all my patients will start ambulation, i.e. within the 24 hours, and they will be discharged home the following day once they are confident in walking, as well as taking care of their essential activities of daily living adjustment.
Mr. Chua, how about post-operative care?
But post-op hospital visits are limited to only 3. The first one will be at 2 weeks post-op for the wound inspection as well as opening of stitches. A set of home physio are taught at this point of time as well. The second one will be at the 6-week mark, in which more assessment and function of the new joint as well as the post-op X-rays will be taken. And last will be at 3 months mark, when most patients will be declared fit to carry on the pre-morbid and pre-surgery activities. Any extra inquiries out of these 3 can be handled by our teleconsultation portal. We can also provide home visit for patients that require extra care at home by our nurses as well as our physiotherapists.
Looks like the hospital and you have all the consideration done to resume on the elective orthopedic surgeries.
I must say we have given it enough thoughts to make sure that our patients will have a safe and successful surgery at this time. Let's embrace the new normal together in a safe and controlled manner.
Mr. Chua, there are some few questions from our Facebook readers. Let's take a look.
Hi, Saraswati. I think you have 2 problems here. Number 1 is the bunion of your feet, and number 2, the one that you have pain while waking up from sleep because of the plantar fasciitis. Both these problems, yes, can be helped to a certain extent by shoe wear as well as some special sole. But sometimes, if the pain is too much to bear, then it's probably advisable for you to go and visit one orthopedic surgeon to get a further treatment. Hi William, I think your mother who has got a total hip replacement seems to be not walking very well. There's a possibility that the hip might not be done very well, and hence she's having pain. So that's the reason why she always like to sit down or lying down. Now, after a hip replacement, it is very important that a patient will be up and about walking and not sleeping and sitting too much. By sleeping down too much, what will happen is the lung will get pneumonia easily, just like you said. And I think at this point of time, you probably need to bring your mom to go and see a joint surgeon to have a look or a good look at the joint that has been replaced, whether is it done properly or not. If it is not done properly, potentially she may need a revision surgery. Hi, no Liana. It is common for young people to have back pain. It is because young people are actually normally very active. You probably do a lot of sports, or sometimes because of the work nature as well, that you need to carry heavy stuff and everything, you potentially can get back pain. Back pain, there are many reasons behind, and one of them is within your second question where you said slip disc. Slip disc can cause back pain as well. You said the slip disc, is it curable? To a certain extent, 84% of a slip disc can recover to a certain extent, but another 16% of them they do have recurrent problem or a continuous pain in the back as well as pain down the legs, by which this will probably need a further treatment, more invasive treatment that is necessary.
Alright, thanks Mr. Chua spending your precious time with us. As every good thing may come to an end, that's all for today's episode. We hope that we have done enough enlightenment in terms of orthopedic care. Should you have any further inquiries, please do not hesitate to make an appointment via Pantai PGI to visit Mr. Chua's clinic for further consultations. In addition, you may also have e-consultations at home with a just click away. Just register on our eHealth portal for appointment. Till then, stay tuned for another episode of Vitalyse.
And on that note, stay calm and stay safe, and please remember to practice the 3W. Wash, wear and warn. Goodbye.